Hi, my name is Leanna. This is my school badge. And today we are going to do the remediation for the IV insertion and discontinuation. And before we get started, I just want to talk about my setup here. I have some supplies. So this is my pretend hand sanitizer. And these are my pink gloves. They are the gloves that I have available. They are the one that fits my size. The one in the kit, they were just way too big for me, so that we're gonna go with those. I have the IV starter kit, and inside the starter kit, we have some tape, we have a tourniquet, we have a Tegaderm, and we have an alcohol pad, and I also have some more alcohol pads over here just in case. We have an 18 gauge needle, some normal saline, some tape, and I did pre-cut some tape on the side over here. Let me just do one more just in case. And then I have the IV extension tube and a pen. And then this is my sharps container. I don't know if I went over that yet. So before we get started, what we're gonna do is we are going to call the provider to make sure that there's an order. And then so we called the provider. He confirmed that he wanted us to insert an IV for a blood transfusion for this patient. So now that we have confirmed that, I'm going to enter the patient room, knock knock. So I'm gonna pull the curtain for patient privacy first. Hi Mary, my name is Leanna. I'm your nurse for today. I just got off the phone with the provider, and the provider wants us to insert an IV so that you can have a blood transfusion later. But before we get started, can I have you verify your name and birthday? And then so her name is Mary Doe, birthday is January 1st, 1990. And then we verify that on her wristband, so it is the correct patient. And then now that we have the correct patient, let me move this way a little bit so I look at the camera. Now that we have the correct patient, I'm gonna ask Mary. Hi Mary, are you allergic to anything? Mary said that she is not allergic to anything. That's great. That's perfect. So the first thing I'm gonna do before I get started is I'm gonna perform some hand hygiene. So we're gonna perform the hand hygiene, and then I'm gonna put on some gloves. Perfect. And then now that I have the gloves on, what we're going to do is we're going to prep the tube. Oh, actually, we put the one thing in first. And then so what we're doing here is we're gonna push the normal saline. Oh shoot, I already took it off. Okay, we're gonna push the normal saline through just to make sure that there's no air bubble. Okay, and oh, so it's watered all the way through. And what we're gonna do is we're gonna clamp and remove, and we're gonna place it here and keep it sterile. And then now that we have all that, I'll prep that. I'm gonna get the tourniquet, and with the tourniquet, we're gonna apply it on the patient's arm, about 4 to 2 inches away from where the insertion site is. And then Mary, you just let me know throughout this whole procedure whether or not you feel any pain or discomfort, okay? And then we're gonna tie the tourniquet in a way where it's easy to release. So we don't want this stuck on the patient. Okay, tourniquet is on, and then the next thing we're gonna do is we are gonna clean and sterilize the area. And it is an alcohol pad, so what we're gonna do is we're gonna go in circular motion and get that whole area clean. And then while we wait for that to dry, the next thing we're gonna do is we're gonna get the needle, and then we're gonna make sure that the bubble is facing upwards. We want it, okay, so after we make sure that the bubble is facing upwards, we are going to insert the needle at a 30 to 45 degree angle. So I'm going to get it at a 30 to 45 degree angle. And once you start to see that blood come out, what we're going to do is we're going to flatten it out, and then we're going to go another quarter just to get the catheter to the hub. And then once we get the catheter to the hub, we are going to click and release. And then once we get this part, we're going to dispose of this into the sharps container. And then once that is disposed, the next thing we're going to do is we are going to connect the extension. And we are going to make sure that we see some blood withdrawal. So when we see that blood return, after that, we are going to insert some normal saline. And then unclamp, insert the normal saline all the way through. And then in this case, we're gonna pretend that I inserted the whole entire normal saline, because the water is coming through the silicone, and when that happens, the tape has a little bit of trouble sticking to the silicone. And then so we're gonna pretend that we inserted all the normal saline. And then after that, we are going to clamp it, and then we are going to get the tegaderm. And with one hand, magic trick here, get the tegaderm while holding onto catheter, because you don't want the catheter wiggling out of place and hurting the patient. And we are going to stick the tegaderm right over the catheter. Make sure it's all in place. And then we're going to remove this part. And we are going to keep this on the side, because we do need to write our date on there and all the other information that we need. So after we get the tegaderm on, it's not sticking very well because of the water. And then we're going to get the tube, and we are going to make sure we're going to tape it up, but away from the catheter, so that we can still see the catheter, the insertion site. And then so with the piece that we took off earlier, what we're going to do is we're going to put our name, our date, 12/18/25, the time is 2 p.m, so 14 o'clock military time, and then the size of the gauge, which is 18 gauge. And then I'm going to take that little piece right there, and we are going to stick it on the tegaderm, but away from the catheter site and the needle, because we still want to be able to see the insertion site to make sure that it's not dislodged and there's no irritation or anything like that. So Mary, I forgot to remove this. After we put on the extension cord for the catheter, that's when we remove the tourniquet. So after we remove that, we tape it down, labeled it, educate the patient, Mary. If you see any irritation, rashes, or anything like that, you go ahead and let us know. And then we provided the patient education. So Mary, do you have any other questions for me? Mary stated that she doesn't have any questions. She also verbalized that she felt no pain or discomfort. And then so I'm going to lower the bed into the lowest position possible. The call light is within reach. Okay, Mary, since you don't have any question, I'm gonna go ahead and get your room all cleaned up and go on and get out of here. If you do have any question, the call light is here. Make sure you just let us know, okay? And then so I'm gonna grab all my supplies. We don't want to leave anything in the patient's room, and we're gonna clean this all up. And I'm gonna pretend that I put this all in the trash. So my trash is on the side. I know it could be seen in the camera, but I don't have any more counter space. So now, patients in a safe position, call lights within reach. I'm gonna go ahead, and I already provided patient education. I'm gonna go ahead and remove my gloves and perform hand hygiene. And then after I perform hand hygiene, what I'm gonna do is I'm gonna leave the room, and I'm going to document the IV insertion procedure that took place, what we saw in the catheter, how the patient tolerated the procedure, the pain, there's no imputation, and also the gauge and the size of the needle. And then so that's all taken care of. And then now we leave the patient's room. And then now I'm gonna set up for my the next part of the video. So this is a whole another video now. So this is my gloves. Let me just get another one just in case. these are my gloves. Oh, let's remove this because we don't need this in the video anymore. We do need some tape. So glove, hand sanitizer. We don't need this. Okay, so glove, hand sanitizer, something to dispose the IV extension in, some tape. Actually, let me use this tape a little bit better, and then some gauze. Oh, I used it earlier, so it's a little stuck. Okay, some gauze. Okay, so this is all we need for the next part of the video, which is the discontinuation part of the video. So before we discontinue the IV, I do want to verify that my name is Leanna. This is my badge, and so we're gonna call the provider to make sure that we have an order to remove the IV. So I just called the provider, confirmed that he did want us to remove the IV now, and then so I'm gonna go enter the patient room. So the first thing I'm gonna do is provide patient privacy. We're gonna pull the curtain, knock knock. Hi Mary, it's Leanna again. We just called the provider and he did confirm that he wanted us to remove the IV now. And then, but before we get started, can I have you verify your name and your birthday? Her name is Mary Doe, birthday is January 1st, 1990. So we did verify that on the wristband. It is the correct patient. So I am gonna go ahead and get started now. And Mary, again, do you have any allergies? Mary doesn't have any allergy. She's not allergic to latex. So we're gonna go ahead and do some hand hygiene. I'm gonna perform hand hygienes with the hand sanitizer, and then I'm gonna put on some gloves. Starting to get a little nervous, you know? Okay, I did this video like maybe 10 times. Okay, so now we got the gloves on. The first thing we're gonna do is we are going to remove the tape. And then so what I'm gonna do is I'm gonna hold on to the catheter because we don't want the catheter wiggling all over the place and hurting the patient. And then we are going to start with the tape and then move our way around the tegaderm, holding that catheter in place at all times. And then also, let's see, after we get to where the catheter is, remove the tape, and now we are gonna get a piece of gauze and hold that right over. And then after that, I'm going to remove, actually let me get another piece of, get another piece of gauze, and we're gonna put it here while we remove the catheter. We're gonna hold this gauze here for 30 seconds in place, and then while we're doing that, we're gonna inspect the catheter to make sure that there's no broken pieces or any pieces that's left behind, because that can cause more problems later on. So we did inspect it, there's no broken pieces. So what we're gonna do is we're gonna dispose of that now. And then this has been here for 30 seconds already. We are going to remove this old gauze and we are gonna get some new gauze, and we're gonna place it over, and then we're gonna get some tape and I'm gonna tape it down. And then Mary, did you feel any pain or discomfort? Mary stated no, she didn't feel any pain or discomfort. Mary, do you have any questions for me? Mary stated no, she doesn't have any question. She's surprised that the procedure went very well and really quick. Yes, that's it, Mary. That's all I have for you. And then, like I said before, you feel any type of pain or irritation, or you start developing any type of rash, you go ahead and let us know. So I provided the patient education, and then I'm gonna go ahead and lower the bed in the lowest position possible. The call is within reach. I'm gonna remove all the trash, and then all the trash is removed. All the supplies are taken out of the room. I'm gonna take my gloves off and perform hand hygiene now. And then I'm gonna, right after we leave the room, patient is safe. We are going to make sure that we document the procedure that we did. So we did remove the IV, and then I also want to document that the patient tolerated the procedure well. There was no pain or discomfort or anything like that. And that's it. All right, thank you.